Hi, my name is Jackson Jones, and my business is Microflow Diagnostics. The problem I'm trying to address is that there's no reliable two-in-one test for the COVID and flu, and that the current tests are uncomfortable for patients and they're not always accurate. My solution for this is a two-in-one test that's faster, more reliable, and is going to utilize a revolutionary technology with microfluidics and lab on a chip, and it's also going to be a more comfortable sampling method. Now I'm going to explain the science of my innovation and how my place of care test is going to work. First of all, microfluidics are like a tiny little lab that's going to analyze substances and fluids and be able to mix and test those substances. I'm also going to use saliva, which is easier and more comfortable to extract from patients, and studies have shown to be more accurate at times than nasal or throat samples. Firstly, someone will spit in the tube, and then a droplet or two of their saliva will be placed on the chip. Then the antibodies at the bottom will mix with the saliva to test for any virus antigens present. It'll travel along the chip until it is ready to be analyzed. The chip will then be placed onto a microparametric meter to be analyzed. Then it'll show a screen like this to determine whether or not someone has one of the viruses. So the cost to make these would be buying a chip reader, the supply of antibodies, and the chips. And the chips are reusable and the chip readers are reusable, but the antibodies will need to be new for every single test. So looking at the expensive cost of these antibodies, we should be able to sell for about $410 to be a profit of $100 or $200. And also, potential buyers would need to continue to buy chips and antibodies from us. This product brings a very huge value as it's the only reliable two-in-one test of COVID, and it also is one of the only tests that has a good price, comfortability, accuracy, and speed when compared to competitors. This test also has some unique values as its speed and accuracy, portability being such a small chip, and that it's power-free, which is going to save money in the long run for people, and that the chips are reusable. So now I'm going to talk about the traction of this product. We have a survey out there that's ever growing in data, but currently we can see that the vast majority of people have taken a COVID or flu test before. And also the majority of these people would prefer to take one test that could do both because it saves time, it saves money, and it's overall more efficient. Also, you can see that the testing market is huge, as one of the competitors, Quidel, had $460 million in sales just by making COVID tests. Now I'm going to speak about the investability and why you should invest in this product. There's a constant demand for COVID tests, so these tests will always be needed. The market for these tests and microfluidics is ever growing, and there's a big future and constant growth. As microfluidics, the science is constantly improving and getting better, and this test could potentially be an at-home test with all of its portability. I would spend the $1,000 on equipment, PDMS chips, a microfluidic reader, and antibodies so that I can start to make these tests, test them, and get them on the market as quickly as possible. This is a recap of what I talked about today, and hopefully you enjoyed my presentation. Thank you for listening.